Hello, I'm Dr. Shantila Vadiyar for TotalPregnancyCare.com. I'm going to talk to you about the ultrasound scans or sonography during your pregnancy. The first of these scans is called as the dating or the viability scan. This is done between 6 to 8 weeks of pregnancy. This is a very important scan because it's the first time you're going to see your baby's heartbeat and actually listen to it while the operator is doing the sonography. This is also an important scan because your obstetrician will determine the due date or when the baby is going to be delivered. The second important scan is done between 11 to 13 weeks of pregnancy, and this is called as the nuchal translucency scan. This scan determines the risk of your baby having a condition called as Down syndrome. So what is Down syndrome? This is a chromosomal abnormality that affects 1 in 900 babies. The importance of this condition is that it can lead to certain congenital anomalies in the baby and also cause the baby to have neurodevelopmental delay, also known as mental retardation. Hence, clearly, you would want to know whether your baby is at risk of developing this condition. This test involves measuring a fluid at the back of the baby's neck on the ultrasound scan and correlating it to various other parameters on the scan to give you a risk assessment for Down syndrome. A blood test measuring the free beta HCG and PAPA, which are two hormones in your blood, is also done along with the nuchal scan, and the two factors are put together to give you a risk for Down syndrome. The third important scan is known as the anatomy or the anomaly scan. In this scan, the baby is checked from top to toe for any malformations. The baby's brain, spine, heart, kidneys, extremities, etc. are checked, and any abnormalities, if picked up, will be discussed with you by your obstetrician. The last important scan that is done is to check that your baby is growing well. This is called as a growth scan or a fetal well-being scan. Apart from measuring the baby's growth, this scan also looks at the amniotic fluid around the baby and the Doppler studies of the cord blood that is flowing to the baby. This gives us an idea about how your baby is developing and whether the baby is healthy for the pregnancy. Of course, their babies can be either small for gestation or large, and not all large babies are healthy. So we need to know whether the baby is getting enough nutrition and is growing well, or is going to be a small baby, also known as growth restriction. Your obstetrician will tell you more about how your baby is doing inside the womb after looking at these scans. For any further information regarding pregnancy, childbirth and baby care, please do visit our website on TotalPregnancyCare.com. Thank you.